First and foremost, parents should understand that your child's behavior does not define you as a parent or as a person. You are the best parent for your child. You are not alone in coping with behavioral challenges. Almost every child will have behavioral difficulties, sometimes at multiple junctures in their growing up years. When coping with challenging behaviors, it is helpful to keep in mind that your child is trying to communicate with you through the behavior. They are not trying to upset you on purpose. First, control the environment. Set yourself up such that you avoid saying no too often. Where practical, put away items that you don't want your child to touch or close doors to areas of the house you don't want your child to access. Put your child in a playpen when you cannot supervise them closely. When out, prepare to keep your child busy in situations where they might be bored and disruptive. Secondly, keep to a few necessary and realistic rules. It is hard for children to follow too many rules, and having unrealistic expectation only sets the child up for failure. Thirdly, keep your child in a calm state by meeting physical needs like sleep, food, diaper change, and managing the amount of stimulation the child gets. Fourthly, find opportunities to praise your child for displaying the right behavior multiple times throughout the day. A child who only hears no would begin to think that nothing they do is right. When using verbal praise, be specific. For example, say, "I like how you kept your toys after playing with them." Praise can be physical too. Give your child a hug or tangible rewards like a sticker or a snack. Lastly, be consistent. In order to be consistent, parents must consider if a child's request is reasonable before responding. Consistency refers to you sticking to the decision you have made at that point in time when you choose to say yes or no to your child. Pay attention to how you communicate with your child. A child cannot act effectively on ambiguous instructions. Ensure that you have your child's attention. You will be ignored if your child is watching a screen or engrossed in playing. Prioritize instructions and be concise. Avoid repeating yourself too much, as the child would learn to ignore you this way. Give statements instead of questions. An example will be, "Let's go and shower," instead of, "Do you want to shower?" Use do instead of don't statements. A common instruction would be, "Let's walk," instead of, "Don't run." Remember to speak in a calm manner. Help your child learn the instruction well. Children can find it hard to remember many steps of an instruction, especially those that need to be carried out over a period of time, such as over the weekday when the child is in school. Use age-appropriate words and help your child keep track of instructions through visual supports like a calendar or a timetable. Parents can teach your child acceptable behaviors for expressing their frustrations or demands. Note that the teaching and learning of acceptable behaviors best takes place when a child is calm, such as when playing with the parent, and not during the challenging behavior itself when the child is dysregulated. A parent can teach a child to sign, to point, to use language, or other means of indicating his or her intentions. Parents can also teach child self-regulation skills. Help children learn to regulate their unhappy emotions and feel better faster when things don't go their way. A parent can let a child calm down independently when they are mildly upset, such as when a friend takes their toy or when they fall down, so that they can practice regulating emotions independently. Social stories and books that teach social-emotional literacy can help teach children acceptable behaviors in an age-appropriate, fun and engaging way. So when a child is displaying challenging behaviors and is dysregulated, allow the child time to calm down. It is normal to expect that a child should feel upset initially when things do not go their way. It does not mean that they will continue to display the challenging behavior after they have calmed down. If a child finds it hard to do it independently, help them. For example, by finding a quiet corner or removing the child from the triggering environment or situation. Minimize the attention given to a challenging behavior. This teaches the child that negative behaviors will result in being ignored by the caregiver. This is usually difficult in public places when the child's challenging behaviors attracts attention from others. Try to persist in ignoring the child until the behavior stops. When that's not possible, move the child somewhere more private and continue to ignore the behavior until the child calms down. After the child calms down, follow through with the plans or instructions that had triggered the challenging behavior. This tells the child that displaying negative behaviors would not achieve the aim of escaping from a demand. When the whole episode is over and the task is completed, consider teaching or reasoning with him or her on the right behavior. For challenging behaviors that could result in self-injury or injuring others, keep the child and others safe at all times. When a child is head-banging, place a soft surface where he or she is hitting their head on so as to protect their head. When a child is flipping backwards, hitting, biting or throwing things, hold or hug them until they are calm and stop these behaviors. It is important to otherwise give the child minimal attention when these behaviors are ongoing to help the child understand that they will be ignored when doing these behaviors. For example, when hugging the child, consider facing the child outwards and keeping your arms steady, and remaining silent and avoiding eye contact until the child calms down. Remember that challenging behaviors always get worse before they get better. Persist. A behavior usually escalates to its peak just before it's about to extinguish. Hence, hold on to your management plan until the child stops and calms down. Remain calm, even when it's difficult to do so. Your child will learn to manage his or her behaviors better when you show your child how to do it. Model calmness and coping strategies like deep breathing or drinking a cup of water. When behavioral challenges are well managed, they occur less over time. The parent-child relationship naturally becomes more in sync and more positive too.